Hello, I'm Dr. Stephen Blomerth, and welcome to Natural Health Today. This is a show that's dedicated to your questions, your concerns, problems that you may have with a family member or yourself. And we invite you to participate in our show in several different ways. You can send your questions into our show via email at pbdchiropractic@gmail.com. You can telephone my office at 978-535-6155. You can even send a snail mail handwritten letter to my office address, which is 215 Newry Street, Suite 102, Peabody, Massachusetts, 01960. But whichever way you choose to participate in the program, what we'll do is we'll talk about natural health ways to help you or your loved one get better. And we'll disguise your name a little bit so curious neighbors won't say, oh, he has that. But this is what I think of when I think of natural health care. I think of basically 4 avenues that natural health can help you get better. And I'd say fully 80 to 90% of day-to-day common problems that people take to their medical doctor or their internist that they get drugs or surgery over don't require those types of things. They can be helped by a combination of these 4 avenues. One is manipulation of stuck joints. Manipulation of stuck joints can do amazing things in terms of pain and dysfunction to restore a pain-free state and to restore movement, which helps people get better immensely quickly. The other way is muscle work, and I'm talking about not just massage. I'm talking about what we call trigger point work or myofascial release, because your muscles have a relationship that goes from your feet up to the top of your neck and your head, and they intertwine and they help support your structure. That's what muscles do. They not only make you move, but they also give support and allow you to be stable. If you have a knot or some scar tissue or inability for the muscle tissues to glide, you can have all kinds of symptoms that you'd never in a million years think of had anything to do with your muscles. So that's an important thing. The third avenue is exercise, and I'm not talking about the standard exercises that people get by, pumping iron or going to the gym to lift weights. I'm talking about stabilization exercises that strengthen your core and involve no machines at all. And most of these exercises are standing, because that's what you want to do. When you go to a gym and you sit down on this machine or lay down on that machine, that's not going to stabilize you in the way that we all want to be stable, which is standing on our feet, being active. And the fourth avenue of natural health care is nutrition. Probably the biggest single thing that you can do for your body and your health long term is to have a good diet. And it's not so much about taking supplements and herbs and vitamins. It can be, but it's about eating the right foods on a day-to-day basis and not just saying, well, I'll do that next year or the year after, when I get serious about my health. The time to always do it is now, so you'll have good energy, good health, and good repair. So those are the aspects that I think of when I think of natural health care. And I'm going to put on my reading glasses and let's have a look at some of the questions that have come in since our last episode. Okay, Rick writes in from Middleton. He says, I've been suffering from left buttock pain for a few weeks, but I can't go to my chiropractor because I'm being treated for multiple myeloma, and I have an L5 bone in my back that got a compression fracture from the cancer. My insurance will pay for me to go to physical therapy, but they don't seem to help. Should I get a neurostimulator if this pain is from neuropathy? Well, Rick, that's a lot of questions. So let me just translate it for the viewers. Rick says he has pain in his buttock. He has a tumor caused by a type of cancer called multiple myeloma. Multiple myeloma is a pretty serious type of cancer. And apparently this tumor has affected one of the vertebrae in his low back. He refers to it L5. And and in the past, apparently, Rick went to a chiropractor, but he doesn't think he can go now because he has a tumor in one of the bones, and he's afraid to receive manipulative care. Then he goes on to ask about getting a neurostimulator because he's heard the term neuropathy. He's probably heard that term and wonders, is the pain in his buttock caused from neuropathy? He also mentioned going to PT because he says the insurance company will pay for him to go to PT, physical therapy, but it doesn't seem to be going helping him by going. So let's try to unravel all those threads. For one thing, if you have a tumor in a bone, is it an absolute contraindication for you to get any form of chiropractic treatment? The answer is no. A good chiropractor knows more than one way to make your bones move again. We've all heard of the typical way in which there's, the snap or a pop, like your knuckles cracking. That's a kind of dramatic way to do things. But there are many other, what we call soft tissue, low force to no force techniques that can be very helpful, particularly in people who are frail or of ill health, like Rick seems to be, because he does have a tumor that's caused a compression fracture. Could he be helped by those gentler techniques? Why not try it? You just have to find the right person who knows these techniques, and if you tell any intelligent chiropractor you have a tumor in your spine, they are going to approach you with kid gloves and choose only the techniques that are the most gentle to help you. So you probably can be helped to some degree by that. He then mentions going to physical therapy and it's not helping. Well, I wouldn't go to anybody of any type of doctor if it wasn't helping you. What you should feel after each visit is better. All better? Not necessarily all better, but each time you go, you should feel some decrease of your pain, some decrease of your suffering, some decrease of the stiffness or discomfort that you have. That's just a given. If you don't feel better every single time, well, it could mean that you're extremely sick, that you're extremely ill, perhaps extremely overweight, or have some type of condition where stress has got you so wound up that it's very hard for you to perceive any improvement in your function. Let's say that's not the case. He also mentions a neurostimulator. A neurostimulator is an electrical device that can be put on a person that sends electrical current through a person. And that can be helpful if a person has something called neuropathy, which is damage to a nerve, because nerves sometimes can be healed if they get a gentle electric current going through them. Well, if you only have pain in your buttock, that's not a sign, that's not a typical sign that you have what we call neuropathy. It does mean that you might have pressure on a nerve, but that's not the same thing as neuropathy. Neuropathy is actually a change in the nerve through, it can be many different things. It can be from taking statins, it can be from having diabetes, it can be a result of having chemotherapy. Many different reasons can cause nerves to get unhealthy. But just pain in your buttock, that's not a common sign of having neuropathy. Could you put an electrical current through that area and block the pain through a TENS unit? That's possible. Will that address the reason why you have that pain? It's pretty unlikely that that will address the reason that you have that pain. This is what I would say. When you go to any practitioner, you want of any type, you want them to be able to diagnose your problem and find out what it is, not just treat you carte blanche like a shotgun for some type of pain. And that's what typically happens in a physical therapy or in a general practitioner's office. He'll just give you some anti-inflammatories or some painkillers to block the pain. Your practitioner should be able to find what's causing it by examining you and using their hands to find, can you find a tender spot? Where you have your pain, where you feel your pain is not always where the pain is coming from. a wise practitioner, one who knows their anatomy and pain referral zones, will be able to look at you, see where you're pointing to, where you perceive the pain. The first thing I might do is touch on that area. Touch on that area, perhaps in Rick's left buttock, and see, is it painful right where Rick perceives the pain? I'll bet you a nickel that if you press on that area, that he doesn't feel pain right there. It's probably generated from some other place, and he's perceiving it there. So any practitioner you go to should be able to find the area that reproduces your pain and then go about treating you. How they treat you is less important than finding the cause of your pain and going about relieving it, because there are many different techniques that can relieve the pain. But the first thing is find out what's causing the pain, because when you find the cause, how you affect the cure can be secondary. So Rick, I'm sorry you're so ill right now, but the question that you ask can be helpful to many people, not only those who have cancer, but also people who have any type of pain that they're not sure how to get better. Thanks for that question, Rick. Okay, our next question comes from Mike. Mike writes in from Beverly. He says, 2 months ago I started having some right shoulder pain. I didn't fall on it or anything. It came on gradually. It feels better since I had a cortisone shot and the physical therapy exercises, but still bothers me when I play drums and hit the snare. Any ideas on how to get my shoulder better? Okay, so Mike, he has some pain in his shoulder. He didn't do anything that he knows. In other words, he didn't fall skiing or trip or anything like that, or jam his shoulder or get hurt playing touch football. It just came on gradually, but he has pain in his shoulder. He did have a cortisone shot. He's had some physical therapy exercises. He's feeling better, but he notices that when he plays drums, and he says, particularly when he hits the snare. Now, if I was a drummer, the snare would be sort of in front of me, in between my legs, and the motion that you use to hit the snare is this type of a motion here. So this motion here involves internal rotation every time you do this. And so that internal rotation makes me suspect certain muscles may be involved. And just kind of like in the same situation with Rick, what you want to do is go to those muscles, the muscles that involve internal rotation of the shoulder as well as stabilization of the shoulder, and feel around. Because sometimes I've had people say, well, I feel the pain in through here. They'll feel the pain down the front of their arm. Well, you go to that area and you press and you look for sites of pain down the front of the arm, and there aren't any, but they're perceiving it here. Sometimes the trigger points that sit on the back side of your scapula, the back side of your shoulder blade, you press on those, and the people just about jump out of the chair, because that's where the pain can be coming from. Those muscles get used over and over again to not only produce that internal rotation of, say, making that hit on the snare drum, but also stabilizing the shoulder. So the trick is to find the muscle, work on it. And something else I might mention, when you have, say, a problem in your right shoulder, you also have to do some treatment to some of the stabilization muscles on the opposite side, because these stabilization muscles that don't work in a vacuum, they pull, imagine like a horse's reins of a horse. There'd be a rein from the right, rein from the left, and they go to the horse's head, and they turn the horse's head in different directions. Well, if you do something on one side, it's going to alter the opposite side. So you have to, if you want to get rid of pain on this side, you have to do something a little bit to address probably what has come about, some trigger points that aren't quite so obvious on the opposite side. So when you have a problem on the right, you also have to treat the left. So that's just a simple idea, and I hope that might help you get better, Mike. The cortisone kind of throws a monkey wrench into the situation, because it says, with cortisone, were those exercises that you were given really helpful, or was it just the cortisone masking your pain for a while? Again, cortisone doesn't help any condition. It helps the perception of pain. Cortisone stops the healing. Inflammation is not so good, but inflammation is a step in the healing process. If you totally stop inflammation, you don't allow the healing to progress. What you have to do is calm down the inflammation naturally do some things that will stimulate healing in order to restore function. And that is probably what will help Mike get better. So Mike, thanks for that question. Okay, our next question is from Karen. Karen writes in from Danvers. She says, one of my girlfriends saw you a couple of years ago, and you helped her a lot with her knee pain. How do you help people who have a bad knee with a meniscus? I had an MRI of my knee, and they said I have a partial thickness tear of my left meniscus. They already tried a scope procedure on my knee, but it didn't help. Should I just have it replaced? Well, that's crazy. Karen, if you have a pain in your knee, the last thing you want to do is have your knee replaced, because that's totally throwing in the towel. Now, some people need to have their knee replaced, but it's very, very common that people have pain in the knee. They'll have an MRI, and the report will come back a partial thickness tear of a meniscus. In order to totally tear and destroy your meniscus, you have to have something violent. If you haven't had something violent, we didn't get a whole history from Karen, but I'm going to bet that there was nothing violent. There was nothing like a twist or getting tackled or falling down a flight of stairs that might have jammed her knee. I'm not saying that that's the case, but many, many times people come in with knee pain. How did it start? I don't know. It just started hurting one day. And then you have to start searching for answers. So all of us, if we live to be old enough, we get wear and tear, because the meniscus in our knees is a medial and a lateral, on the right and on the left. They're made out of cartilage. And this cartilage, it wears down over time. It doesn't mean it's gone. It just means it wears down. So when the radiologist reads the MRI, their diagnosis can be partial thickness tear, because most of us, if we live to be old enough, some of the fibers in the meniscus will be a little bit worn. That doesn't mean it's the cause of your problem. The way to diagnose a meniscus tear is it's something violent, and it will stop normal motion. It'll stop either fully straightening your knee out or fully bending it. If your knee gets stuck and won't go past a certain point, that's a sign that a meniscus has actually torn, flipped open, and jammed in between the two bones in your knee, and won't allow the normal straightening or the normal closing of your knee. That's a true meniscus tear. So I have had many, many patients come in over the years, and if you touch along their knee joint line, if you find a place that when you press in, they just yelp, that's not normal, because you should be able to go to any joint line, press along the joint line. It might be a little bit tender, but to have the person yelp out and say, "Oh gosh, that's my pain," that's not your meniscus. That's where your meniscus is held on to the outer surface of your knee joint line by a little thing called the coronary ligament. The coronary ligament can get strained by all kinds of things, by having a short leg on one side, having flat feet, doing all kinds of things. It's a very simple fix. I just have learned where to find it. I go back and forth across the fibers. I use some kinesio tape on it, and the way I know that person is better, I've had them do something like climb some stairs to right outside my office, see how it hurts, treat them, have them immediately go back out and climb those stairs, and 9 times out of 10, boom, that pain is much, much, much better. It doesn't mean they had a torn meniscus that needed to be replaced. It didn't mean that they need to have a knee replacement. They just had to have an adequate diagnosis and adequate hands-on treatment. The way to judge any treatment is, how do you feel immediately after? If it's the right treatment, you'll feel better immediately after, and that's what we try to do. Karen, thanks for that question. Okay, Joanne writes in from Danvers. She says, you talk about how it makes a difference what type of calcium you take. You said one of the better types of calcium is something called calcium lactate, but my daughter is sensitive to dairy. There's some other good calciums you can recommend. Well, calcium lactate I can recommend, but calcium orotate, calcium glycinate, But here's the thing that I want to correct with Karen. She's mentioning that her daughter is sensitive to dairy. Many people are. But calcium lactate doesn't have any lactose in it. Lactose and lactate, they're totally different things. Lactose is the sugar that's in milk. Some people are sensitive to it and they can't drink milk. That's fine. But if you take calcium lactate, you're not going to be getting any lactose. Lactate has some of the same letters as lactose. They're not the same thing. You can take all the calcium lactate you want. You're not going to get any lactose from it. So Joanne, that's a good question. And a common misunderstanding, when people haven't studied biochemistry, they don't know. The names sound familiar, and so they get confused between lactose and lactate. Calcium lactate, perfectly fine, even if you're dairy sensitive. Joanne, thanks for that question. Okay, Kim writes in from Danvers and says, I don't know if you can help with this problem, but I get bad back pain every time I have my period. It's so intense that I can't sit or stand, and taking 800 milligrams of Advil doesn't help. I know I have endometriosis, but I haven't had time to have a hysterectomy yet. Can I be helped to at least help decrease my back pain? Kim, you probably can. Endometriosis is extremely painful for women. It's something that men don't get, but it's a condition that women can get, and it's a very complex situation that needs help on a nutritional, endocrinological level, and sometimes at the very worst, it can require a hysterectomy. But having a hysterectomy may help with your endometriosis, but there can be so many other problems down the line when a woman doesn't have her ovaries, because they put out some very essential hormones that women need. But a person can be helped if they have back pain from endometriosis or from just a bad period each month, because when you have pain in your vaginal area and your uterus, and it causes a reflex symptoms, spasm in the back muscles, those back muscles can be helped to feel better by treatment at chiropractic office through chiropractic care and through muscle work. So will it change the underlying endometriosis? No, it won't, but it'll help break some of the reflex pain that's involved with that. Also, good nutritional help can mitigate some of the aspects of endometriosis so that together it can make it more livable. So Kim, I'm sorry you're having pain, but I know you can be helped break part of that cycle when you have a period that's intensely painful and you can't sit or stand. You're right, taking 800 milligrams of Advil won't help, but I've seen people come into the office be in intense pain, can barely get their breath, strained look on their face, and leave laughing and feeling much, much better. And that's, again, without drugs, without surgery. So thanks to all of you for participating in our show. And I'd just like to remind you that you've been watching Natural Healthcare. I'm Dr. Stephen Blomerth, your host, and I hope that you'll participate in our show and send in your questions. We'll disguise your name a little bit. We'll talk about natural ways you can be helped. You can send them into pbchiropractic@gmail.com. You can telephone my office at 978-535-6155. Or you can send an old-fashioned snail mail letter to our office address, which is 215 Newry Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you choose to participate, we'll try to come up with a way for you to help yourself be helped or get the proper care. And that's all I have to say for this week, so I'll see you next time, next episode of Natural Health Today. Thanks a lot.